Imagine going to bed every night, feeling so sick that you're not sure if you'll wake up the next day, experiencing rage and panic attacks, and using dissociation just to get by. I would describe my health journey growing up as alienating and very confusing. My disabling symptoms started when I was 14, and by the end of the summer, I could barely walk. My knees were the worst symptom, 9 out of 10 pain, nothing alleviated it, and it was also really hard to be so young and accept that I had to give up sports, that I could no longer be an athlete. Growing up, doctors were very dismissive of my symptoms, so I probably saw well over 50 sports medicine doctors, pediatric and adult, same with orthopedic specialists, and same with rheumatologists, all specifically just trying to figure out why my knees were causing so much pain. But then I started developing pretty significant neurological symptoms about 1 year after the initial presentation of the disease. Initially, it manifested as rage attacks, primarily directed at my parents, and then it progressed to tics and tremors, and I eventually started having seizures and a crippling insomnia. I was not diagnosed properly until I was 26 years old with Lyme disease. Lyme disease is a bacterial spirochete infection that is usually tick-borne, but it is possible to get it in utero, and I'm an example of that. My mom is also diagnosed with Lyme disease. Because Lyme disease was untreated, it invaded my central nervous system. I had developed autoimmune encephalitis. I have basal ganglion encephalitis, which is a subtype of autoimmune encephalitis. So essentially, my brain is attacking itself just in the basal ganglia region, and that can manifest with differences in your cognition and your emotional regulation and your motor skills. So things like seizures, tics, tremors, starting to perform poorly in school. Your brain truly feels like it's on fire and like your head is going to explode, and it just feels so heavy and fatigued. While I'm on subcutaneous immunoglobulin therapy, the antibodies are pulled from plasmas from people who donate, and essentially it helps the immune system regulate and stop attacking itself, so in this case the brain. I would say I'm at a pretty good point right now with my encephalitis, with the worst remaining symptom being the insomnia. I take medication for the insomnia, but even some nights that's not enough, and I don't have good sleep. And I do get some tics occasionally and have some fine motor skill difficulty, like dropping things. And then I also struggle with retaining new information. I use my platform to talk about chronic illness, and my focus is on Lyme because if I can reach other people and give them the information that I didn't have and should have had access to when I was a teen, then I can help prevent a lot of suffering.
The most rewarding thing is getting messages from people saying, because of you, I was able to get a doctor to listen and test me, and now I'm in treatment.
The advice that I would give to other people in my situation are to not give up after a first or second opinion. Keep getting opinions until you find someone who really digs deeper. I am seen. Are you?